Coming up today, from fear to remission, the treatment and teamwork helping keep this dad's cancer in check with a single pill. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. We often hear about beating cancer, but thanks to advances in screening and treatment, more and more people are coexisting with cancer. That is to say, living with cancer, managing cancer like a chronic disease instead of a terminal illness. I met a man who is finally able to get some normalcy back into his life despite his stage 4 diagnosis.
Ready, girls?
50-year-old Yuri Solis is a husband and father to 2 little girls. He's also an avid runner.
I love running.
So when Yuri experienced pain in his lower back, he thought no big deal.
Because the physical activity, I'm gonna just wait.
But his pain persisted.
So much pain. I couldn't do anything.
Doctors ordered an MRI, and that is how Yuri and his wife Erin found out it was likely cancer.
Of course, we're in complete shock and worried, very worried.
I have some illness in my body, but I just want to go and find what is it.
Yuri was referred to the University of Kansas Cancer Center Olathe campus.
I'll just have you on the end of the table here.
There he met medical oncologist Dr. Larry Coram and his team, who recognized right away that Yuri's cancer was different and he was very sick.
For me, this was this really compelling sort of collision of science and emotion.
Yuri, a non-smoker, was diagnosed with non-small cell lung cancer caused by a rare gene mutation.
So many of the people that sit in my exam room are dealing with the most significant, most important, and in many cases, most devastating thing that they've ever faced. Let's look at your scans here.
Dr. Coram helped Yuri face his cancer, which had metastasized.
During that time, I was very scared. I didn't want even to read about cancer. He was one of the persons that mainly gave me some kind of hope.
But Dr. Coram knew that hope would require a village.
I'm a medical oncologist. I don't have the expertise and the knowledge and the skill set of a radiation oncologist or a thoracic surgeon or a cardiologist, which we needed in this case.
Scans showed that Yuri had multiple lesions in his bones and on his liver, and there was more.
As you can see, this fluid or this blood is pushing at the right side of the heart.
Yuri was admitted and put into the hands of cardiologist Dr. Jamil Abuzatin to remove the excess fluid squeezing Yuri's heart.
So if you see between the liver and between the heart, there's no space here. That black space is gone.
Next, Director of Radiation Oncology, Dr. Bertram Maidment III, was brought in.
It became clear with advanced imaging that there was something more to the story than just chronic pain.
Yuri had 11 brain metastases in addition to the massive pain in his bones.
His pain was so severe outside the brain, in the body, in the bone lesions, that Dr. Coram knew he needed treatment immediately. He couldn't wait for something that might take weeks and weeks to alleviate pain. We needed to get going very quickly.
Dr. Coram knew Yuri's rare ALK gene mutation qualified him for a medication to treat his very specific form of lung cancer.
Many of these people on just a pill, just a daily pill like he's taking, are going to be living years and years and years, and often in a complete remission.
Which is where Dr. Coram considers Yuri to be living. That word, remission, brings the ultimate hope.
We were basically back to living our normal lives and didn't think about cancer 24/7 like we did in the beginning.
It's a new beginning for the Solis' story, and one that this team of doctors is blessed to play a role.
It always feels really good to know that the patient is doing well and what we've done for them is helping. So that's the best part of the job.
You go from this moment of terror, and feeling as though, this is my responsibility, right, to figure out how to get this person out of this, this predicament, to this moment of elation when you see the results and you're able to deliver that.
It makes us feel phenomenally good as a team to be able to have all the tools here to help people such as Yuri lead a productive, happy life, to create more memories and to flourish.
And what about me?
And we are happy to have Aaron and Yuri with us this morning. Aaron, sorry to get the waterworks going on you on this Monday morning, but we're just so glad to have you both with us. How are you both doing?
I'm doing okay, thank you. How about you?
I am doing well. I'm doing well. It's so good to see you both again. Aaron, how are you doing? And how are those girls doing?
They're doing good. Yep, they're just off screen watching us right now. So
good,
yeah,
good.
They're doing good.
Oh, we love to hear that, and I know your doctors feel the same. Also joining us, Dr. Larry Corum. He's a hematologist and oncologist at the University of Kansas Cancer Center in Olathe. And we also have Dr. Bertram Maidmont III, a radiation oncologist and the director of radiation oncology at the University of Kansas Cancer Center in Olathe. So Aaron and Yuri, again, we cannot thank you enough for sharing your story with us. Yuri, take us back before the diagnosis. You were in pain. We mentioned you were a big runner, but this pain just simply would not go away. Was it just in your lower back? Where else was it?
Yeah, I think I started feeling in my back, just kind of like a pinches in my back. And then they start going down more lower back, and they kind of like stay in my hips. Especially my right hip. It was so intense. It was increasing in level of pain, so much pain that sometimes I couldn't move my leg. And that was in the summer of, end of the summer 2023, when I feel that kind of a, progressive pain. By the end of 2023, the pain was so intense in my leg, I couldn't move anymore. I even feel like shaking with the pain. And it was all in my hips, my lower back, so intense.
Yeah, you use the word intense. And as we grow older, we tend to slip off pain, and just get used to it. But Aaron, you know your husband better than anyone. What was different about this pain this time? What made you all decide to go see a doctor?
Yeah, well, let's see. We've been married, 12 years, 13 years, and in that whole time, I think I seen him go to the doctor one time, and that's because he was bleeding and needed stitches. So he's not one to go to the doctor. He hardly gets sick. When he does, he says, no, we don't need to go to the doctor. So my first clue was when he essentially begged me to take him to the doctor because he was in so much pain. And then, of course, just seeing him, I could tell that this was different. He'd come home from work early because he couldn't work any longer from the pain, and he'd just lay on the floor in the fetal position, in so much pain. I could tell he was on painkillers of all sorts, and it just wasn't touching it. So we knew that this was different. And so ultimately, we kept going back to the doctor. We'd do physical therapy, and just nothing was working. And finally got an MRI, and of course that revealed the cancer in his bones.
So you get this cancer diagnosis, clearly a lot of fear, devastating. But Aaron, Yuri, both of you, I want to hear from both of you. What gave you hope at that time?
Yeah, in that moment, I would like to say that it was so, intense. It was so much, confusion. But one of the things is I feel kind of a hope is knowing these professional doctors, the knowledge that they have. Particularly, I have a engineering background, and I know when you do some research and do some experiments, and I see that part gave me some kind of a confidence, all right, so they are professionals, they know what to do. So that's kind of the link that I feel okay, so we could do something in here. A lot of support for that side, for the, all the team, the medical team that we saw. And for emotional part, I think my family was always there. And I say we could do this. Let's try. And I'm ready for whatever is the treatment, and I'm ready to do it. And Aaron was always with me, and we tried to do it together. And that was basically the hope that I had at that moment, and a lot of support.
Aaron, where did you find the hope in those moments that were really scary for you? I know.
Yeah, similar with Yuri. I think we have a lot of faith in the research community. We're both researchers, so we see the importance of that. We know that there's doctors, scientists working really hard at coming up with new treatments every day, trying to understand not just lung cancer, but all forms of cancer better. And I think that's where we have the most hope, is just that research is going to continue to evolve. There'll be new innovations coming out. That really gives us some hope. And then, as Yuri said, of course, like, we have the best care team. Just really can't imagine having a better one. Dr. Coram, Dr. Maidment have been awesome. Like, all the nurses, the schedulers, the greeters, like, everyone at the Cancer Center is just really amazing. And that gives us a lot of hope too, because they don't talk to us or treat us like, doom and gloom, I guess you would say. Like, it feels much more positive, it's more matter of fact, and that really gives us hope about the situation as well. And I guess I don't know, me personally, well, I've had a number of friends go through cancer and with successful results. So, that gives me some hope as well. And then I think, just for me personally, again, knowing Yuri, like, he, excuse me, excuse me, he, he's a big fighter. He never gives up. He'll never admit these things. He's very humble, but he grew up in a small town in Mexico and found his way to England and got his PhD in England, and that took him a long route to get there. And when we lived in Colorado, he just decided to take up running, and then before you knew it, he was winning half marathons. He was training nonstop, so he's aware. He can very much overcome battles and works very hard and just never gives up. And so, me knowing that about him gives me hope.
I love hearing that. He's lived a lot. He's got a lot more to go. Dr. Coram, I want to bring you in here. Just how great is it just hearing about Yuri's life, and of course just seeing Aaron and Yuri here this morning with us?
Yeah, it's absolutely terrific. Aaron, you're not supposed to make me cry right before my segment, so please don't do that. Jessica, did you have another question for me? Or?
Yeah, I just, Dr. Coram, you mentioned in the video when we watched, you said something about this being a collision of science and emotion. Tell us a little bit more about what you mean by that.
Sure. I think that we often think of emotion and science as being separate or even incompatible. But what we do in the oncology clinic every day is we bring emotion and science together. And it's actually one of the things that I love about oncology. One of the things that drew me to oncology is that strange and kind of wonderful mixture. So, when someone gets a cancer diagnosis, it's often quite devastating. It's one of the most difficult, if not the most difficult thing that person has ever dealt with. And so, understandably, there's a tremendous amount of emotion. But our role, I think, is to educate people and to bring the science to bear on that problem. And we can often do that very effectively. And that's, one of the things that I think, is often misunderstood. I think people get a cancer diagnosis and they just sort of assume that it's going to be the end.
And Dr. Coram, explain a little bit more about this gene mutation that Yuri has. How did it impact his treatment in this case?
Well, it impacted his treatment hugely. It was critical to understand the nature of his cancer, what was driving cancer.
Essentially, there are two basic types of lung cancer. One's called small cell, the other's called non-small cell. About 85% of lung cancers are the non-small cell variety. And among those non-small cell lung cancers, we've learned that many of those cancers have certain driver mutations that essentially accelerate their growth. Once upon a time, we simply gave chemotherapy to everyone with lung cancer. Some patients responded, some patients didn't. We didn't always understand the reasons. But in the last 10 to 15 years, genomic testing and molecular testing has become critical to understanding the nature of a cancer and what is driving that cancer to grow. And so in Yuri's case, we did a molecular panel, and we found what's called an ALK gene mutation or an ALK gene rearrangement. Now, it happens to be the case that only about 5% of non-small cell lung cancers have an ALK gene rearrangement. But for those 5% of patients, it's an absolutely critical finding, because this means that a patient is able to take an oral therapy daily that is typically much more effective and often much less toxic than traditional chemotherapy. So it was critical here. It was a game changer.
Do you expect to see more targeted therapies in the future, of course, then leading to bigger, better outcomes for patients?
Absolutely. Oncology has changed dramatically in the 20 years that I've been doing this. And as time goes by, it seems to be accelerating, certainly every year, if not every month. The pace is accelerating and the discoveries are expanding. So we mentioned that we do genomic testing now on all lung cancers, and that's also extending to, many other cancer types. I expect us to continue to find driver mutations and other unique characteristics of these cancers that basically cause these cancers to behave in a certain way. And once we understand that, our understanding of molecular biology and chemistry, and, this is not me personally, right? This is a whole team of pharmacists and biologists and, various people from various fields who can actually create designer drugs that can specifically target, a mutation or an abnormality that may be creating that cancer to grow.
I want to bring in Dr. Maidment. In Yuri's case, Dr. Maidment, the cancer had spread, as we had mentioned, to the bones, the liver, and the brain. Did all of those sites that we mentioned receive radiation?
That's right. Yes, his initial site of treatment was the bones, specifically that area in the right hip that Yuri was describing as being the most painful. That was felt to be very urgent, given the fact that he was at risk for what we call a pathologic fracture of the hip or the backbones, which itself can delay or prohibit any additional therapies from being received for weeks while a patient recovers. The second area that received treatment was Yuri's brain. He actually, upon staging imaging with MRI, had 11 small brain metastases ranging in size to a little over ½ an inch, and a couple of them were in critical locations, high risk for neurologic deficit or seizure or some other adverse outcome if they were not treated. So that area was treated as well.
Is it typical for it to spread to the brain? I mean, how would you know to look there?
So non-small cell lung cancer certainly has a propensity to spread to the brain, goes that way through the bloodstream. So anyone with a new diagnosis of this type of lung cancer would have a brain MRI, typically with and without a contrast agent, to screen for or try to detect these brain metastases if they're present. And in Yuri's case, there were, as I mentioned, 11 of them, the largest a little over 15 millimeters, which is over ½ an inch in size. And at a time when we usually don't have that next generation sequencing or molecular analysis testing of the tumor itself completed. So we don't know if he will have a targeted agent, and what we do see is a set of lesions in the brain which themselves may cause an adverse event. So we would jump on that very quickly with what's called stereotactic radiosurgery, which is just a name for a very high dose very focused radiation with what is often referred to as sub-millimeter accuracy. And despite having surgery in the name, there's no cutting involved. It is delivered all by way of an X-ray beam over the matter of just a few minutes in a single treatment. But that's the treatment that Yuri received to his brain.
Dr. Maidman, I know that Yuri's case was quite complex. What's it like seeing him sitting here with us this morning?
It means everything. Absolutely. It means everything. And we've all shared in this emotion in the last year plus time frame for sure. And it's been quite a journey for Yuri, and seeing he and Aaron, hearing how Yuri's doing is always incredibly rewarding, and we're just overjoyed for them.
Yuri and Aaron, we know that cancer takes a toll on mental health, even when it's considered in remission. How are you handling this as a family and as a couple mentally?
Yeah, like I said, you know, I feel better now. I mean, mentally, I feel much better. That gives me more like you know, my body feels calm. I try to do a lot of like more physical now. I don't want to think about like so much in that part. You know, the cancer is still in my mind from that work, you know, but I try used to see it differently. I think I like that part, like coexisting with cancer, which is kind of like you are saying in your introduction, like it is more like a chronic illness that is going to be there. So that gives me more like you know, I can do it. Seeing my girls, seeing my wife, my family. I think that's a lot of support I have in here. So that part is, and also I wanted just to say, you know, again, the professional medical team is you know, I just want to say thank you, and thank you many times.
Aaron, how have you talked to your girls about this? And what questions have they had?
Yeah, I mean, in the very, very beginning, when it was all just a very big shock and everyone was scared, who was it? Someone at the Cancer Center gave us a book specifically for talking about cancer with kids. And so we sat down with them right here on the couch, and Yuri read it to them, and they seemed to understand, you know, that this was a serious disease, but that it was okay. Daddy was going to go through treatments, but that he would be okay, and they didn't have a lot of questions. I think for the younger one especially, she doesn't necessarily get the difference between cancer and maybe COVID, right? So in some regards, we don't talk about it a whole lot with them unless they do have questions. We kind of, for everyone's mental health, try to just live our normal lives, I guess. And we're blessed that we're able to do that. I know not everybody is, but we, you know, because it is very scary still and very uncertain. But we try not to just sit and talk and think about it. You know, we both work full time still, so many parenting duties with the girls, and they're in so many activities that keeps us just super, super busy and keeps our mind off of it, which for us has been a blessing, and it helps tremendously.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Dr. Corum, do you feel there's somewhat of a stigma still surrounding lung cancer in particular?
Yes. Well, I think there is a stigma. I mean, it is the case that the vast majority of lung cancers are still smoking related. But I think it's important to understand that, you know, many patients who have lung cancer may have quit smoking years ago or even decades ago. And there's an important segment of lung cancer that is not smoking related. You know, as much as 15% of non-small cell lung cancers are not related to smoking. And this is a population in particular where some of those mutations that we mentioned, some of those favorable so-called driver mutations,
are more likely to be present actually in patients who have never smoked.
I have a question. Dr. Maidman, question for you about multidisciplinary. How important is that when it comes to a case like Yuri's? As we mentioned, how complex it is when you're working with doctors like, as we mentioned in the piece, with like Dr. Abuzatin, with yourself, and of course, Dr. Coram. How important is it that all these doctors come together and use their expertise to help get a patient like Yuri on the right path?
Absolutely, Jess, and it's critically important. I think, as Dr. Coram alluded to earlier, the multidisciplinary nature of cancer care is something that is often the biggest draw for those of us who enter into the field, because we have a specific skill set. At a place like KU Cancer Center, Olathe, fortunately, we have excellent technology, but we each have an individual skill set. And to work with others who also share the same goal as you of not just taking care of patients, but really being with them on that journey. We have a team here, which I'm so blessed to say takes wonderful, wonderful care of the patients that we see. And we all share not just in the goal of providing care together with our own individual skill sets or technologies or roles, but also all being as optimistic, as supportive, as compassionate as we possibly can be for those we care for. So that's something that when you share a team that is not just skilled and has abilities, but also has compassion and intelligent and credible ability to be emotionally intelligent as well, it is really, truly game-changing.
Well, let's get to some questions from our viewers this morning. Jill has a question, and Dr. Coram, she wants to know, we know that the pill is less toxic, but are there side effects to the pill that Yuri is now taking daily?
Well, every medication has some potential side effects. These particular pills, these ALK inhibitors, they can be associated with some bowel changes at times. They can be occasionally associated with some skin toxicity. But these are medications that don't typically cause nausea or vomiting or hair loss or suppression of the bone marrow, as we would typically see with most chemotherapeutic agents. So while there are some potential side effects, they are generally mild by comparison. And Yuri can correct me if I'm wrong, but I think Yuri's done quite well with the medication, maybe some mild fatigue at times.
Yuri, how are you doing on those pills?
Yeah, I'm just following your treatment. Yeah.
Doing well. Good to know. Stu has a question. Dr. Maidman, I think this is for you. Why are metastases on the bones so painful?
That's an area where they often grow from the inside out, the marrow, the middle of the bone where the blood cells are made, and it doesn't take a lot of growth or pressure to hit those pain receptors. And it can be a very deep pain, but there's also nerves that run, large nerves often right nearby, and if those are compressed or pressure is put on those, it can quickly become a severe and very complex pain.
Dr. Maidman, I'm going to stay with you, and I want to get our takeaways today. For those watching and listening, what is the biggest takeaway from our conversation?
I'd say the biggest takeaway from my perspective is that the word hope has been used, and there absolutely can be hope. And in the fear of a new cancer diagnosis, it is critically important to ask questions, to listen to those experts who have your best interest in mind, and sometimes to get more than one opinion even, to attempt to find the team that fits best with you. And certainly in the modern era, cancer care has evolved dramatically. So many patients tell us stories from just a few years ago, and we can fortunately update them with stories that have changed very much just in the matter of a few years. So ask questions, seek out providers who have your best interests in mind, and give hope to what you may hear.
Thank you. Great to see you. Thanks for your expertise this morning. Dr. Coram, what's the big takeaway today?
Well, I think there are two. One is that cancer therapy is changing. You heard me say that in the 20 years that I've been doing this, it's changed quite dramatically. Yuri's situation, when I started, Yuri would have gotten some type of chemotherapy. He may have responded for a few months or maybe 6 months, frankly, he would have been fortunate to live a year at that time. Yuri and I met a year ago, and he looks tremendously better than he did when we started. And I expect, many, many years to come. So cancer therapy is changing. This is not the 1970s version of oncology that many people have in their mind. So that's important. And then I think, again, the critical nature of a multidisciplinary team, which is really what makes my work incredibly enjoyable, along with this emotional piece that I mentioned at the beginning.
Dr. Corum, great to have you today. Thank you so much. Aaron, what's the big
Thank you.
takeaway from your story, your family's story?
I guess just pushing through. I think just trying to live normal life, being as busy as you can. I know that's not going to be the case for everyone, that they respond as well to treatment, but I think just for anybody going through this cancer journey, it's a great opportunity to reflect on things that are most meaningful, to you. So whether that means that you keep working full time, whether that means you go part time, traveling more, just whatever brings you the most enjoyment, and not because you think your life is going to end anytime soon, but just that it's a moment to really reflect, I think, on what matters the most to you, and to make sure that you're spending that time, doing those things that bring you enjoyment and keep you busy.
Great advice. Great advice. Thank you again for sharing your part of the story, Aaron. Yuri, wrap us up. What's your final message as we head out today?
Yeah, I would like to say, for those that they are just, they find out about the cancer, I would like to say, just talk with your doctors, learn about the cancer. Don't just go and get so, I know that this is so dramatically, changes everything, but just find out, learn about the cancer, learn about the doctors, make that confidence with them, find the hope. They are professionals. They can tell you everything about the cancer. And then start preparing with the treatment. The treatment is going to be long, but you could do it. You could be preparing with that mentally, emotionally, everything, physically. And then you will see that it's going to be rewarding. Coexisting, that's another word I wanted to say. I like that word because that gives you okay, it's there, but I'm still here. I'm happy, I have my family, and I can do many things. I have a new job, and I'm enjoying it.
Love it. Thank you so much. Thank you so much for sharing your story. Get back to your girls and enjoy your life. Thank you. And thank you all for this great conversation. And before we go, we want to acknowledge all of the women in medicine, as today is National Women's Physicians Day. If your doctor is a woman, or you know any ladies in medicine, consider saying thank you. Thanks again to all of our guests, and thanks to our viewers for being with us today. Of course, we'll see you right back here tomorrow. Coming up tomorrow on the Morning Medical Update, colon cancer rates are rising in young people. A newly diagnosed patient in his 20s shares his battle. I'm Jessica Lovell. On the next Morning Medical Update, learn the signs and symptoms to look out for, Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.
I think, let's see.